For being here today for the Ohio Legislative Black Caucus press conference on minority health. Before us today is our action team, our health action team. You may remember on February the 13th, we had a press conference event unveiling the Ohio Legislative Black Caucus action plan. Since that time, we have been going down that list of items that are important to the 1.4 million African Americans in Ohio. Since that time, we've had a meeting with Governor Kasich where we hand-delivered the action plan and met with him and members of his cabinet. Out of that meeting already, one of the action steps is in this budget. There's a commitment to reopen and even elevate the minority business division, and they are in the process right now advertising for a director for that entity. And so that is back in the budget. One of the major action steps as it relates to minority business in our plan that was released on February 13th. In addition to that, and there's a number, if you don't have a copy of it, we can copy it to you today. But one major component deals with minority health. And we identified some issues that we would tackle in this GA as it relates to minority health. This is Minority Health Month. We thought it would be only appropriate to have a press conference stating our stance as it relates to the Medicaid debate. We are very clear and have been clear in our action plan that we support Medicaid expansion. In addition to the expansion, we also support initiatives that will close the health disparity gaps here in Ohio. In a moment, you will hear from our action chair, Senator Tavares, who will walk you through step by step as it relates to our initiatives and what we're asking for as it relates to minority health. We thought we'd do something a little different this year. Usually we're cutting ribbons and having an event celebrating Minority Health Month. But it's kind of hard to celebrate when we have a budget currently that we're debating that does not include Medicaid expansion. Something that will impact not only all Ohioans, but also impact the African American population. We have seen various numbers that go upwards from 300,000 to almost 500,000 African Americans that could be impacted by Medicaid expansion. We don't need to tell you that in every category dealing with health, African Americans are disproportionately affected. Minority populations are disproportionately affected. Whether it's infant mortality, whether it's diabetes, whether it's cancer, whether it's how many folks go to the hospital versus go to preventative care and go to a doctor. Just this week, we have met with hundreds of citizens from our district who have come up to the State House literally begging for Medicaid expansion. Just yesterday, we had a senior citizen from my district that came up to my office on a cane, was up here trying to march, losing cartilage in her right knee, has breast cancer in her left breast, and pleading because she works for a small nonprofit and just can't afford the care that she needs to make sure that she can fight these symptoms in her health care. She has been referred to the hospitals in order to get care, which, as you know, costs the taxpayers a lot more dollars. So be very clear that today we're here supporting Medicaid expansion. Our members that are in the House, we support the standalone bill and have signed on to that. We are asking that the governor help provide the additional votes needed to get it back in the bill. But in addition to that, there are some other minority health issues that we want to make sure are included in the budget. So at this time, you'll hear from Senator Tavares, who will walk you through the plans that we're asking for. Then you will hear from Dr. Representative Sykes, who will also talk about a pilot program that we'd like to launch across the state of Ohio.